Hi, in this video I'll be talking about some new updates to the labeling by the Food and Drug Administration for breast implants. We talk a lot about how breast reconstruction is an important part of your care. Many women aren't eligible or don't want to have a more lengthy procedure where we use your own tissue, like your abdominal tissue or tissue from the back. And so breast implants are something that's considered. These can be silicone or they can be saline. The FDA, after years of reviewing evidence, has come up with a couple warnings that we wanted to make you aware of. First of all, although very rare, breast implants can be associated with breast implant-associated anaplastic large cell lymphoma. Quite a mouthful, and it is a pretty serious condition. Again, this is not very common. It's quite rare. It presents with pain or swelling in the breast or a breast mass around the implant. And it requires removal of the implant and sometimes additional tissue. Most people don't need more than surgery, but some people have needed chemotherapy or radiation therapy. So again, an uncommon side effect, but clearly linked to having breast implants. We know this is more common with textured breast implants than with the smooth implants, but we don't want to say that there's zero risk with the non-textured implants. I'll come back to this in a moment in terms of how you should be followed. The second thing is that breast implants have been associated with a systemic syndrome of fatigue, rash, joint pain, and some people have described memory problems or brain fog. For many people, when the implant is removed, those symptoms go away, and it's not clear at all that they're related to the breast implants, but it is something that the FDA, the Food and Drug Administration, which actually approves devices, not just foods and drugs, they look at devices. They've recommended that people be informed of this risk if they're considering breast implants. So important things to know are that breast implants are not considered a lifetime device. And the risk of these problems, both the rare but important anaplastic large cell lymphoma and the breast cancer sort of immune response, increase over time. So that the longer one has an implant, the more likely one is to get these problems. The other problem we know about is rupture. That can happen with silicone implants or with saline implants, and it's usually pretty noticeable. The implant will change in size or shape, and it can be quite sudden. But there can also be a leak. So leaking of silicone or leaking of saline should be checked for the longer you've had the implants. So it's recommended that about 5 to 6 years after your surgery, you have an MRI of the breast implant or implants, and every 2 to 3 years after that. If you have symptoms, or if an ultrasound is done and is suspicious for a leak, you should have an MRI right away. Again, most people will require surgery at some point for one of these complications, and some people choose to have removal of the implants if they have this immune-like systemic syndrome. The FDA also recommends that we learn more about what's in the implants in terms of heavy metals in particular. So some work is being done to be really crystal clear with people who have an implant, what might be seeped from that implant. And finally, it's recommended that patients who have an implant get a device card that tells them the number, the lot number, the serial number of the device, and so that you carry that with you, that be given to you, you carry that with you after you have the implant, so no matter where you go, anybody who's attending to problems you have can look it up. So in summary, there's a new warning, it's actually called a black box warning from the FDA about breast implants that makes it clear that implants should not be considered lifetime devices, that there's an increase in the risk of something called breast implant-associated anaplastic large cell lymphoma, and also breast implant-associated immune response. Following up, reporting symptoms, getting MRIs to look for rupture, and carrying a device card are all updated recommendations from the FDA, and we thought you should know about these as part of our work in sharing this. If this has been helpful to you, like and subscribe, and other people can find this important video. And I hope this information has been helpful to you. We'll have some links below to give you more information.